Hello, my name is Jackie Molaski. My perspective is a little bit different from Charlie and Shanae, so I'm going to try and use some of my experiences and thoughts to walk through my 5 minutes. So I work for the American Association of Blood Banks, and I recently received my master's in public health from GW this past December. My concentration was in maternal and child health, and I also have a certificate in HIV studies. So I am particularly interested in sexual and reproductive health, HIV and other infectious diseases, adolescent health, program implementation, monitoring and evaluation. So all the epidemiology and everything that I heard today was really valuable, I think, as I'm pursuing my career in public health. I also did my master's thesis on how men and women use the internet differently to access sexual health resources online. So the technology piece is something that's really growing for me and something that I think we've touched on through this 2-day conference is so valuable as we look at how to change health today. So there are a couple points that I wanted to mention just in reflecting about everything that I've heard today. The first thing is from what Dr. Conger, I think it was, spoke about this morning in terms of social media, networks, communicating with people, and how valuable it is to really accept that, you know, young adults use cell phones more now than we ever did before. And when my parents learned to text, that was really something so amazing to me. And it's mostly not because I don't want to talk to them on the phone, but if I need a quick message to them, I don't want to have to pick up the phone and have a whole long conversation. It's, you know, communicating with your child, with other young adults, it's quick these days. I'm sure my parents are watching now and are very upset about that. So the second thing is that Dr. Halpern Flesher spoke about new media and two-way communication, which I think is so important because young adults have a lot to say. We want to be heard. Reading newspapers, reading magazines, we can't get out what we want to say, but using Twitter, Facebook, we feel like we have value. We're developing our self-identity, and I think by using two-way media, it is becoming even easier to be able to do that. But the downside to that is that young adults can really be taken advantage of that way. I think that there's a lot of ways advertising, videos on YouTube can go viral online, and people post without really thinking about what it means, what it says about them, you know, regardless of the pictures of people drinking, but just what messages they're putting out there. And, you know, if you post something related to a campaign, you know, you're really tied to that political belief, and people are going to see that. The third thing is in relation to the discussions this morning about college health and about harm reduction, which I think is a really important model for promoting health behavior change. So the thing I was thinking about is really not punishing people for bad behavior, but rather rewarding people for good behavior. And what I mean by that is when I was in college, we had a rule that was about if you saw somebody who was sick from too much alcohol, using drugs, you won't get in trouble if you get them the help that they need, which is so important because it shouldn't be about punishing people. It should be about making sure that they're getting access to health care. So I think, you know, with the party schools and encouraging safe drinking, because kids are going to do those things, just really making sure they have the resources to access those health care needs. The fourth thing is something that came up a lot in my public health work while I was studying is this idea of edutainment, which is the combination of education and entertainment. And, you know, young adults, we like TV, we like movies, we like social media, and really pairing those together, I think, is a really good way to get messages across. It just makes me think of a story that I heard of a young woman who was a rape victim who knew not to shower because she had watched Law and Order. And as someone who is a big Law and Order fan, you know, these are messages that we hear a lot, and we want to make sure that what the media is saying, you know, makes sense and is correct. The last thing I will say is about training young adults to, in terms of mental health, making sure that they can see risk factors in other young adults. So, you know, our friends may be depressed. We're not psychologists. How can I have the tools I need to really provide resources to my friend? So there's one more thing that I have to say is today my friends on Facebook are probably very annoyed, but I posted that I was doing this and asked if I could be a voice for them and get feedback from them. So I have a couple things. I asked my friends on Facebook what young adult health issues are important, so I wanted to share a couple of the things that I got on Facebook. And this was all throughout the day I just have a couple. One is health information access is one of the biggest health problems young adults face, where to find it, how to evaluate it, and how to act on information if society, parents, friends are unsupportive. I also, another thing was about this edutainment, the idea of having health issues that are really come across in the media accurately. So for example, teen pregnancy. A lot of people know of 16 and Pregnant, which kind of glamorizes this idea of teen pregnancy. Another one I got is on the homeless population, making sure that shelters are funded, there's work training provided, and opportunities. Along with homelessness is spending time focusing on what is working and what isn't. Homeless shelters spend a lot of time counting the people they're helping, but no time digging deeper into seeing if the people are better off as a result. One more thing is how can young adults become more efficacious in medical decision making? So this speaks a little bit to health literacy, specifically what can be done for young adults to better understand how health insurance works and how to navigate the system. And then a couple other things that came up is smoking cessation, sexual education, and mental health. So thank you.